For every new mother, birth is supposed to be a moment of fulfillment. But pregnancy is filled with surprises, not all of them pleasant. Joy can be tempered by fear.
Isn't that crying?
Surgeon.
And birth can be a struggle for life.
Heart rate is coming up.
In the high-risk maternity ward, every special delivery comes with its own perilous conditions. At San Diego's Naval Medical Center, 29-year-old Marilee Gibbs is in familiar surroundings. She's already had 2 children and is now pregnant with twin girls. But this time, there's a problem. One of the babies isn't doing well.
So all the fluid is around baby A. And of course, let's see if we can see it. There's the head again, baby B. Baby B is starting to get a little bit smaller than baby A and had a little bit less fluid than baby A yesterday. And the fluid is low, it could mean that the baby is sick or a little stressed.
The babies are fraternal, which means they have separate placentas. It may be that baby B's placenta is damaged and not supplying enough blood and oxygen.
In the worst acute example of damage to the placenta is an abruption, where the placenta separates from the wall of the uterus. And that can be catastrophic and lead to the death of the baby. So we want to get the baby out long before it comes to that.
There you go. That should be good.
Baby B also appears to be semi-breech, so the safest course is an immediate C-section.
I'm already nervous about having a C-section because I've never had them. I've had 2 vaginal deliveries with no complications. So, but it'll be good because they're going to do tube ligation, so no more babies.
Monique Williams is trying to fight her way through natural childbirth.
Breathe through it.
She is 24, and this is her first baby. Monique voluntarily chose not to have an epidural to ease the pain.
I guess it's all the stories I've heard about some of the side effects that they have on the baby as far as reflexes and things of that nature, and I'm just determined to go natural.
Natural childbirth is common throughout much of the world. Even in the United States, many mothers choose to go without painkillers. But it too can have risks. Prolonged pain sometimes causes chemical imbalances that interfere with contractions and blood flow to the fetus. And the pain can tire a mother out too early.
The second stage of labor, when you're pushing, is more stressful for the baby, so you want it to be as short as possible. And so if their energy is spent by the time they're ready to push, then that can actually be a detriment.
Excellent.
If that happens, tools may be needed to extract the baby.
You're placing instruments into the vagina so you can have lacerations to mom, and you're instrumenting the baby so there can be injuries to the baby.
In severe cases, a C-section could be necessary. But right now, all Monique can think about is working through the pain.
You're doing a great job. So you're 6 centimeters now, okay? But the head's coming down really low. That's why you're feeling that pressure. Probably a little more than a centimeter in under 2 hours, okay? So you're starting to change faster.
Monique's husband is stationed in Korea. He's trying to get here in time. Meanwhile, Monique's family is her support.
There you go. It's almost over. You should be getting really close now.
Hi, how's it going? Are you feeling any pressure yet?
A little bit.
A little bit? Okay. Are you feeling your contractions at all?
Nope.
No?
22-year-old Ebony Simmons is 37 weeks along on her first pregnancy.
When I came in this morning, I was at 6 centimeters, and I was having major contractions every minute. And they decided to keep me.
One of the doctor's major concerns is that Ebony is a type 2 diabetic.
When did we last check your sugar?
Diabetes can cause a number of pregnancy problems.
They can be at risk for heart defects. They can have defects a lot in the lower part of their body.
Because they feed on such rich nutrients, the babies of diabetics often grow larger than average in the womb, which makes them potentially harder to deliver. An ultrasound yesterday placed Ebony's baby at 7 pounds 6 ounces, large enough to cause some concern.
I just hope it goes smoothly, that I'll be able to push her out without any complications or anything, because she's a big baby.
Big babies can actually get stuck at the shoulders during delivery.
That's called a shoulder dystocia. It's one of the obstetrician's worst nightmares. Because the head is out and the baby's not getting any oxygen, so as long as the head is out and you can't get the shoulders out, the baby's like having its head underwater. So that can be quite an emergency.
Ebony's pregnancy is also complicated by the hypertension she's had since becoming pregnant. High blood pressure can cause preeclampsia, which may restrict the baby's growth or reduce the supply of amniotic fluid. It can also damage the placenta.
In general, placentas don't work as well the less control you have over their blood pressure. So if the baby's under any kind of stress, you want the baby to have some reserve. A bad placenta often doesn't give the baby much reserve to be able to handle anything like contractions.
You feel this at all?
I feel it.
Not too much, though?
It's getting close to time for Ebony.
Because you just got a little tiny, like, thin rim of cervix up in the front. If you could feel more, you'd probably be able to push it away. But what we'll do is maybe turn down the epidural a little bit, and then when you start feeling more pressure, let us know, and we'll just start to push.
Okay.
Okay? Should be very soon.
You probably won't have to wait 2 hours at all, so. Okay.
I am nervous and I'm really excited. And I just can't wait. Like, it's finally happening.
We'll get you.
We'll get you in a second here, sir.
I never thought I'd ever have twins. But twins run in my husband's family. So, and he told me when I got pregnant, you're having twins. Sure enough. And then he told me I was gonna have girls, and sure enough.
Down you go. We got you. No falling.
The problem is that one baby has much less fluid than the other and is semi-breech. Even though it's a week before Marilee reaches full term, doctors want to get the distressed baby out as soon as possible.
We kind of weigh the risk for the baby on the outside versus baby on the inside. By doing a C-section at 35 weeks, we risk a little bit of lung immaturity, but we think that at this point, it's healthier for the baby to be on the outside. We won't hurt you, promise.
The C-section starts well.
There's your spot right here, Dad. Just scoot on in.
Scoot her in.
Baby A, Carly, is out in a matter of minutes.
Little girl.
Carly!
No helping, no helping.
It's not a toy, Carly. Hey, little one. Got it. Alice, please.
Baby B, Naomi, is more of a struggle. She's in an awkward position and has to be rotated before she can be lifted out.
BB is a girl.
Uh-huh.
There you go. Baby D's a lot smaller.
Actually, both babies are small, and both are having some trouble breathing.
Baby A, they may have to give her some oxygen.
All right, Carly, let's go, girl.
They get a brief visit to Mom and are then rushed to the NICU for further testing.
1508.
They both needed oxygen initially because actually their color was a little blue.
And as the NICU doctors are about to discover, the baby's troubles have just begun. For Ebony Simmons and her husband, Dustin, the waiting is almost over. She's a week past term and has 2 potentially serious health problems.
She's interesting that she has both high blood pressure and diabetes. Hi. We're gonna try a push, okay?
The biggest concern is that high sugar levels from the diabetes have produced a large baby, which will make it harder for her to deliver. And there's a danger the baby can get stuck as it comes out.
And push. Hold your
Push,
breath.
hold in your bottom.
Bear down
Come
in your
on.
bottom.
3, 4, 5. Harder. 6, 7, 8, 9, 10. Good.
Ebony's hypertension has also raised the baby's heart rate. Dr. Tatro keeps a close eye on it.
Baby's heart rate's going down a little bit with the contraction, but nothing concerning. It's normal.
She's doing pretty good.
What color is it? No haystack.
Ebony continues to push, but the baby is stalled.
You know, the tissue around the baby has folds in it, so when the baby gets down low, it's kind of right up against the bone there, and so the tissue in your vagina can actually, you know, be mistaken for cervix. And okay, you're making progress. Okay, it's gonna be a little bit, but you're doing well.
Keep at it.
Okay.
But Dr. Tatro is still concerned.
Basically, I'm worried about whether the baby's gonna fit or not. We're just waiting to see. She's pushing well, so it'll be a little while, but hopefully she'll do well.
Every half hour, we want your contractions to get stronger, and to do that, we increase it by 3 cc's. So we'll go from 3 to 6.
36-year-old Flory Rodriguez, mother of 1, is pregnant with twins. She's being given Pitocin to induce early labor because her blood pressure is dangerously high.
I came in for checkup around 12:45, and then my doctor said my blood pressure was 170/110.
Okay. A normal blood pressure is 120/80. And, you know, so when we see an elevated blood pressure like this, it can indicate to us, you know, that maybe there are signs of preeclampsia showing up. Anytime you have high blood pressures, you worry about the placenta being damaged. So with her, you don't want to continually damage the placenta because that's the baby's lifeline.
So I tilt that way a little bit for me, just a little bit.
Doctors decide it is safer to deliver the twins at 35 weeks than risk injury to the placentas.
How far?
Flory hopes to deliver both babies vaginally, but she's been warned that if there are problems, she may have to have a C-section.
If the baby's heart rates are dropping down, something's compromised, you just want to get the babies out, and in that case, you'd move to a C-section.
As a nurse herself, Flory doesn't relish the prospect.
My biggest concern is the C-section because the recovery is very, very complicated, and the C-section is painful.
But as Flory knows, both twins being born vaginally is rare.
Good girl. You're doing good, Monique.
For Monique Matthews, who's trying to have a natural birth, the pain is unrelenting.
She's feeling lots of pressure, so that may be a sign that the baby's head's coming down a little bit or that she's dilating some more. The good news is her cervix is very thin. It's basically completely thinned out or effaced, and the head is down nice and low. So for her, that's causing discomfort, but it's good for her labor course. Hopefully she'll keep dilating even faster now and be able to push within a few hours.
She's been able to endure a lot of the pains caused from the contractions. It's just doing her breathing, and that's enabling her to stay calm. Oh.
Ebony Simmons has been pushing for 1 hour now and can feel her baby moving lower.
Push her, come on, push.
Dr. Tatro returns to do the final delivery.
push. Come on, push. Push. You got it, come on.
The baby's head partially emerges, but the delivery is agonizingly slow and painful. Dr. Tatro performs an episiotomy to enlarge the baby's exit route.
Come on, push hard.
With the head only slowly emerging, the delivery room turns tense. The NICU staff and other doctors respond to an emergency call of a possible shoulder dystocia.
Come on. That's it. That's better. Come on, push through that. You got it, come on.
The baby's head is finally pushed all the way out, but her umbilical cord is wrapped around her neck. Squeezed shut by the tight fit, it is cutting off her oxygen supply.
Come on.
Harder. Come on.
Dr. Tatro cuts the cord and continues to work at freeing her.
Come on. Give us a big push, come on.
But to no avail. He can't get the shoulders out. It is now a matter of life or death. The baby is not breathing and has no heart rate. A nurse jumps on the bed and pushes on Ebony's stomach. The baby has been stuck for over 3 minutes.
Take that deep breath. Push. Harder. Come on, you can do it. All your might.
They reach the baby's arm and try to pull it out.
Push as hard as you can. Come on, harder. You got it. Push harder.
Unsuccessfully.
Push.
But a second attempt works.
Nice job, Ebony. Good job. Somebody cut the cord.
Okay.
4 minutes have now passed. Doctors immediately begin CPR, manually providing air to the baby girl's lungs and massaging her heart.
Give me a heart rate.
When the baby's heart doesn't respond, doctors give her a shot of epinephrine, a form of adrenaline, but still nothing. They give her a second shot. After 2 minutes of vigorous resuscitation, finally, a heartbeat.
Heart rate is coming up. Heart rate is over 60.
Right there.
Barely clinging to life, baby Ivory is rushed to the NICU.
No, the baby's gonna be fine. We don't want the baby to cry just for a minute, okay?
Ebony is panicked. She wants to know why she didn't hear the baby cry.
We'll tell you everything, but right now just take slow, deep breaths. Good, just wipe her brow.
But despite the attempt at consolation, at this point there is no way of knowing what her baby's chances are. In the NICU at San Diego's Naval Medical Center, doctors are working hard to keep Ebony Simmons' baby alive.
Our main concern now is to put resuscitate, so we want to make sure airway is stable, securing the CT tube, and get out of the way so that they can start putting lines in.
Baby Ivory had shoulder dystocia, meaning she was stuck at the shoulders during delivery, a frightening period in which she was without a heartbeat.
As far as we can tell, he spent about 4 minutes with this difficult extraction.
I've actually never even seen a shoulder dystocia that long before.
It's enough time without a heartbeat to have potentially serious consequences, including brain damage.
Any second is unfortunate, but 6 minutes is enough to cause risk. The most important target organ that we're interested in is the head. It will be wait and see to some extent.
The baby could be absolutely fine in the long term or could have some long-term injuries.
Besides being given oxygen through a tube in her airway, Ivory is given fluids through her umbilical cord.
Hi. Mr. and Mrs. Simmons?
Neonatologist Dr. Dale Bull tries to delicately explain to the parents how little they know about the baby's prognosis.
we're in a wait-and-see mode. If there were one test that I could do right now to tell you when she would go home and what she would be like when she'd go home, I'd love to be able to do it. But all the best minds in medicine try and figure these things out, and we're still a long way from knowing what babies are going to be like after an insult like this until they're about ready to go home.
Remind me, what brought you in last time when you came? When I met?
She wasn't moving. She hadn't really been moving much. And
42-year-old Diana Iltis used to work at the hospital as a nurse.
So what's her name again?
Alyssa.
Alyssa.
Alyssa Rose.
Today, she's here as a patient for labor induction.
So what we're gonna do today?
That I'm due on Sunday, and when the doctor suggested that we do an induction, I said sure. Friday's a good day.
Make a fist for me.
Diana, who already has 2 children, arrives with a complicated past. One of her sons, 8-year-old Logan, was born with a chromosome disorder and is not expected to live past the age of 10.
He has seizures and he's tube-fed. He's wheelchair-bound, unable to sit up or hold his head up.
This time, Diana had prenatal testing, not only for any chromosome disorders, but also for Down syndrome, which is more likely in mothers over 40. Both tests came back negative, but they did reveal some frightening news.
I found out that I'm a cystic fibrosis carrier, much to my surprise, and so is the baby. So that's just something that we'll need to look at when she thinks about having her own children. Her husband will need to be tested, and if he's a carrier, then they would have 1 in 4 chance, I believe, of having a cystic fibrosis child.
It's a bridge they'll cross later. Right now, the focus is on delivering baby Alyssa.
It'll be great if we can go ahead and get the bag of waters broken early on. It'll really get things going. So I'll check and see if the baby's head is down low enough, it'll be safe to break her bag of waters. If it's not down low enough, then I'll wait a while, let the contractions bring the head down lower.
Okay, great.
Diana and her husband Derek have brought their 5-year-old son Trevor with them. He is all eyes as Dr. Bratz breaks Diana's water.
Quite a bit of pressure now.
Okay.
There we go. Yeah, just like that. That's perfect.
Clear fluid.
Nice clear fluid. Okay, good.
It's only a matter of hours now. But there's no question that Logan's disabilities and the cystic fibrosis findings weigh on Diana's mind.
I guess my biggest concern today is just to have a healthy child.
Yes, I saw the head.
Monique Matthews' natural childbirth has reached its climax.
Bear down, bear down.
Baby's head
4,
showing. Very
5,
good. We're seeing
6,
more with each
7,
push.
8, 9, and 10.
Hey, I'm Dr. Warner. How you doing?
Dr. Nancy Warner will handle the actual delivery.
She's had an uncomplicated pregnancy so far. She should do very well.
We're gonna give you some numb medication right in the end there, okay, to help with the burning.
Dr. Warner uses a lubricating gel to ease the baby's exit.
Okay, here we go. Big deep breath.
Ready?
And bear down.
And go, 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 go.
With one final push, the baby is free.
Right in between those two. Yeah, perfect.
Baby, so beautiful, Monique. Woo! Praise God. Praise God.
The baby boy, named Amarion, is big, 7.5 pounds.
It wasn't that bad. It wasn't that bad. It was bad enough, but it wasn't that bad. And my plan worked. I did everything natural. And now look good.
He's here.
You see little brother today? Or big brother.
Can you stretch, Mommy?
The day after giving birth, Marilee is sore, but okay.
Hold you for the first time. Hold you for the first time.
Okay, ready? 1, 2.
She's been sleeping all morning.
She was awake first thing this morning. They came in crying, so that was before they were okay to start feeding. So
She's the one that has moved around the most in my stomach, and she's the reason why they're both here right now. She's just gonna be feisty. She's gonna be greedy.
The babies are on oxygen and IV feeding and must remain in the hospital a few more days. Ebony Simmons is on her way to see baby Ivory.
She got her hair washed today. It's brushed on nice.
Ivory, who was without a heartbeat for several minutes, has responded well to treatment.
Last night, they took out her breathing tubes because she's able to breathe on her own, and she didn't need help or anything. And then this morning, they took out her tube that was giving her dopamine, which was to help stabilize her blood pressure.
Ivory's recovery was remarkably quick. It seems she was one of the lucky ones.
It depends on how much oxygen reserve, so kind of to use the underwater analogy, kind of how deep of a breath you took before and how tired you were before you went underwater. So this baby thought, and it turned out to be true, had all the reserve that started with.
Because of that, doctors hope she won't have any long-term effects, but they just don't know yet.
I'm just overjoyed because she's here and she's healthy, and just from them telling me, you're not gonna hear your baby cry. And in my head, I'm thinking, my baby died. And now here she is, and she's perfectly healthy. Our family's definitely been blessed, definitely.
So I'm gonna check you now since you're feeling more pressure. Okay.
Flory Rodriguez is ready to give birth to twin boys.
You are completely dilated. Okay.
Because of dangerously high blood pressure, Flory's being induced to give birth a week early.
Okay. All right.
I can't wait. I'm ready. I hope it will just come out. No problem.
I'm gonna find your little hat.
The deliveries will be in an operating room. Besides the potential problems caused by Flory's hypertension, including preeclampsia, the birth of twins always poses greater risks, especially a breach of the second baby.
Typically, after the first baby is delivered, the uterus is foggy. It's very loose, and the second twin has a lot of room, and even if the baby's head is down, it certainly can flip back up.
There's also a greater possibility that the second baby's placenta can separate from the uterus, causing serious bleeding.
Okay, deep breath in.
7, 8, 9, 10. Oh.
Baby A is an easy delivery.
Take another deep breath.
Deep breath in. 1,
We're gonna plant these ones.
And push, push. Good job. Good job.
Alright. Hey, mister.
It is a boy.
All right, here's your baby.
Baby B, however, is an immediate problem. He isn't down far enough for Dr. Tatro to get a grip on him.
That's an arm.
During the delivery of baby A, baby B seems to have changed positions.
We're just gonna have to do a breech extraction.
Not only is the baby breech, which increases the hazards for both mother and baby, he's lodged far up the birth canal. Dr. Tatro wants to grab his feet to bring him down.
You feel it?
No, it's a feet, but we can let it come if we want to.
Watching the ultrasound monitor, Dr. Tatro tries to invert the baby.
Okay.
The baby gets partially turned, but he is still too high.
Next contraction, we're going to want you to try to push this head into the canal, okay?
There's some fluid.
They manually break the baby's water bag, hoping that will help him drop down. But nothing seems to work.
The head is just way up here.
Florey's contractions and attempts to push the baby down finally get him into a head-first position, but he's still too far up.
Okay, Mrs. Rodriguez?
The cord is coming down ahead of the baby, an extremely dangerous development. The cord can become pinched between the mother and the baby, cutting off the vital supply of oxygen. Now, baby B's heart rate has begun to drop, indicating that's what's happening here.
Okay, and I'll go scrub too. Okay.
It's the last straw for Dr. Tatro, who calls for an emergency C-section.
The cord slipped up from underneath the head, which is why I'm down, so we probably don't have time to wait.
Help the surgeon.
Florey Rodriguez's worst fears have come true. Her first twin was delivered vaginally without any problems, but the second faces a serious crisis.
Cord came down from the head into the pelvis, a cord prolapse, and that's kind of an emergency, and something we need to do a C-section for because the cord can't come out first in the vaginal delivery.
If the cord gets pinched, the baby's lifeline is closed shut.
Okay, large rich if you can.
Dr. Tatro reaches the uterine wall and cuts through.
Got the head? Have it?
I got it.
He has the head, but the baby has twisted again. Dr. Leventis tries to turn the baby.
Second foot?
Finally, the baby comes free.
Oh, plant. Plant.
The baby is given CPR to help him breathe. When she doesn't hear him crying, Florey is frightened.
All right, baby's out.
He's not crying? They're just actually just trying to give the baby a little resuscitation. Good job.
When the baby finally begins to cry, it calms Florey's fears.
Yeah, he's good respiratory effort on his own. He's a good heart rate now, and I think he'll be just fine.
Florey's husband, Ray, gets a look at both boys, and then the second baby is shown to Florey and rushed to the NICU for more care.
The head basically squished the lifeline of the baby, and so that was kind of cut off. And over time, that can lead to problems with baby getting enough oxygen. And baby didn't like it. That's why the baby's heart rate went down. And so we had to proceed pretty quickly to a cesarean delivery, which we did.
But as the doctors in the NICU soon learned, the baby is far from okay. The day after Monique's delivery, her husband Aaron arrives from Korea and gets his first look at their new baby.
It's a joy to be holding my little baby boy, Marion. I've been waiting for a long time.
For Aaron, it's time for a cigar, double bubble style, and even his first pamper change. For Monique, the pain of natural childbirth is now in the past.
It was an experience, and if I had to do it again, from this experience, I would probably do it again. Yeah. If that opportunity arose, I'd do it again.
She felt that she can perform a natural birth, and that's what she did. Anything she wanted to do, she set her mind to it, it's done.
Marilee Gibbs' twin girls are still in the NICU. They were born prematurely by C-section because one of them didn't have enough fluid. Since then, both have had breathing problems.
When mom doesn't go through labor, the babies don't get the stress going through the birth canal, and that also helps them produce their own natural steroids, which kind of helps the lungs mature that little extra bit, and also will help them when they go to take that first breath and hopefully push the extra fluid out of their lungs.
Doctors were afraid that baby Carly's breathing was also complicated by an open ductus arteriosus.
The ductus is a vessel that's open in fetal life to move blood away from the lungs. With the first few breaths and over the first few days of life, the ductus arteriosus closes. If it remains open, then it can cause oxygen requirement, even heart failure to some degree.
An echocardiogram finally shows that Carly's has closed.
They look good from what I can see, and they're doing good. Her oxygen intake is doing good. They're trying to get her off the oxygen completely. Today, her sister's off oxygen. So, yeah, they're little, they're hairy. They're doing good.
But doctors plan on keeping the twins under observation for several more days. Ebony Simmons' baby, Ivory, is finally ready to go home.
She's doing well. She is eating well. All the numbers that were concerning to us very early after her birth have all improved.
But while Ivory's ready to leave, Ebony isn't. She was diagnosed as hypertensive during pregnancy, and the problem has worsened.
It's on her face.
It was becoming evident that she had congestive heart failure.
They found that my heart wasn't pumping well enough, and so they put me on some heart medication.
So both mother and baby will remain in the hospital for an indefinite time.
That's up to her OB doctors, how long she stays in the hospital. From my point, I think in a couple days, she's probably turned the corner and we'll be able to go home.
Any pressure in your pelvis yet?
Diana Iltis is ready to give birth. Her age, 42, and a previous baby, Logan, born with a chromosome defect, have caused some concern. But this pregnancy seems to be going smoothly.
Yeah, you're completely dilated.
Her husband, Derek, and their 5-year-old son, Trevor, watch as Diana begins pushing.
I'm rotating the head.
It doesn't take long.
5, 6, 7, 8, 9, 10.
Pretty close. Good. Hard. Right now, really hard. Good. Okay, now stop. I think I'll
put my gown and gloves on. We're just about there. The head is crowning nicely now, which means about that much of the baby's scalp is emerging when Diana pushes. So we're ready to deliver her baby girl.
Nice, easy push. Feel good.
The baby's head is now out. One more pull.
Oh my gosh.
And there she is.
Delivery 30.
Oh my gosh.
Remember, there's your little sister.
Oh my gosh. Oh, there we go. Oh my gosh. That hurt. Hi, baby. We've been waiting for you.
Okay, we'll just get her dried off right here.
Baby. Oh, look at you. Hi.
These are the kind of deliveries we just love to do because it was very smooth and very uncomplicated, and Diana did a great job. Just pushed the baby right on out. It's actually very common, especially women who've had 1 or 2 babies before. The delivery usually goes very smoothly.
How are you? Oh, yeah. You ready, huh? This is just amazing. Every time it's still amazing.
We considered the thought that she might be like Logan, and the closer we got to the pregnancy, then the less worry I had. But even if she hadn't turned out right, we'd be okay with it. We're just glad that she's here and she's healthy and she's fine.
Welcome to opening home out.
Come on, love, do you want to hold her while she's awake?
It's cool.
For Marilee and Axel Gibbs, things aren't quite so happy.
We're leaving today finally. And feels good, but we're going home without our girls.
The twins are breathing better, but they are being held behind until they learn to eat.
They're not nippling all their feeds. Some of their feeds have to be put into the stomach with a tube, so we're still waiting day by day for their feeding to improve.
They're doing good. They're just too small, which is to be expected. I mean, there's nothing we can do. Baby B's doing better than baby A, and they'll be coming home soon. A few weeks, but we expected that. It's just harder when you're actually leaving.
Life is definitely changing. Of course, life changes. I have to slow myself down to keep up with him. Then once he gets bigger, I'm gonna have to keep up, you know. But it's changing. You ready to go?
See?
And I will give you this, but he's gonna scream if I take my finger out. I feel so good. I'm lost. I don't know where I'm going. I've been in here for so long.
Aaron, how about you?
Yeah, I'm glad to leave with my boy in my left hand.
I've never been to this part before. This is the front of the hospital. Gotcha. The sun is shining. Life is definitely changing.
Things are slightly more upbeat for Flory Rodriguez. Though she too has to leave one of her twins behind, she's taking the other one home.
His name is Josh Anthony, and
The other twin is in the NICU right now because he had a hard time. When he came out, this one is vaginal delivery and the second one was C-section.
Doctors are hoping that the C-section baby, Patrick, can join his brother in a few days.
Because of his prematurity and also because of his ultimate difficult delivery, is having some trouble coordinating his suck reflex and swallowing of the formula on his own.
When he can be taken off of tube feeding, he'll be ready to go. In the meantime, Flory and Ray stop by the NICU to say goodbye.
He's the kicker when he was inside my tummy.
I'm going home. I'm gonna take the baby and go home. I am ecstatic, and so is he. Right?
Yeah.
Good. Another one. More? Good.
Thank you. I'm not sure if we need this or not. No? Oh, wait a minute. I don't know. I feel wonderful today. Physically, I hardly feel like I've had a baby.
Oh, you want to be a big boy, huh?
The whole pregnancy, you think to yourself, this is all going to be worth it, but it never really hits you until after you have the child, how completely worth it is. Just everything to have an addition to your family. It's beautiful. I'm excited to go home. It's like going home is real life, and how it's going to be taking care of the baby and the home and the family. It's very exciting.
They're staying.
Ebony Simmons is finally leaving the hospital. The medications have gotten her hypertension under control, and baby Ivory was certified A-OK days ago.
I pictured me having a baby, being able to come home within the second day. Hi. And here I am 11 days later, just now leaving. You have to live day by day and just not really expect that something bad's gonna happen, but don't sit there and think, that'll never happen to me. It happens to other people. It's like you just can't take things for granted.
It's something all the mothers who come in here learn. When you're dealing with something as precious as life itself, you never know what to expect. Every birth is its own extraordinary miracle. A special delivery that comes wrapped in wonder.